If you've ever tried to pry a stubborn, heavy-duty suction cup off a glass window, you know it requires just a surprising amount of force.
Oh, yeah. It fights back.
Exactly, it's just physics, right? A vacuum seal holds tight, you pull, and it actively, stubbornly resists you. But imagine taking that exact same uncompromising physics, that literal airtight vacuum seal, and placing it inside a healing human body.
Which completely changes the stakes.
Right. Suddenly, we aren't just talking about physics anymore. We're looking at this collision between sheer mechanical force and incredibly vulnerable biology. So today, we are taking your sources and unpacking the hidden biomechanics of menstrual cups to find out what actually happens when physics goes to war with tissue that's trying to heal.
It really is a fascinating landscape because it brings together, anatomy, physics, and just everyday product design in a way most people never think about until something goes wrong.
Yeah.
We rely on that seal to be airtight,
Yeah.
right? We want it to be uncompromising so it doesn't leak. But the consequences of that grip are just drastically misunderstood.
And to get to the bottom of this for you, we've pulled together a massive stack of sources for this deep dive. We're looking at clinical guidelines from hospitals, systematic reviews from The Lancet, gynecological post-op instructions, and, we're even bringing in real user accounts from Reddit.
And that one viral claim from TikTok.
Yes.
Oh.
The TikTok that completely set the internet on fire regarding what these cups can allegedly do to your organs.
Right. But before we can really dissect how suction affects tissue that is actively healing, we have to establish exactly how this suction interacts with healthy tissue. Because the fundamental mechanics they're completely different from anything else in the period care aisle.
Right, because traditional products like tampons or pads, they work on absorption. They act like sponges soaking up fluid. But menstrual cups don't absorb anything at all.
No, not at all.
They are usually made of, soft medical-grade silicone shaped kind of like a bell. You fold the silicone to insert it, and once it's inside the vaginal canal, it just pops open.
And that popping open is the critical moment. When the folded silicone unfolds, the rim of the cup pushes outward against the vaginal walls and physically forces out the air, which creates a vacuum seal.
Wow.
Yeah, it literally suctions itself into place to collect fluid. And that airtight grip it's the only thing preventing leaks.
Which is a brilliant piece of design, honestly, until you forget how powerful a vacuum can be in a closed biological space.
Which brings us to this viral TikTok from a creator named Lux. They're the co-founder of a period relief brand called Some Days.
Right, I saw this one.
So Lux posted a video claiming that a specific brand, the FemiCycle cup, quote, sucked their cervix outside of their body.
Which is just a profoundly terrifying image for anyone to process.
Beyond terrifying. I mean, they described trying to pull the cup out, realizing the cup had suctioned the cervix into the bowl of the cup itself and essentially dragging the whole organ down and out. It resulted in this frantic hospital visit. So looking at the anatomy, is that even biologically possible? Can a silicone cup pull an organ out of you? So what's fascinating here is how the fear outpaces the anatomical reality. We have to look at the insights from Dr. Neetu Bashakal. She's a consultant gynecologist in our sources who frequently addresses these exact fears.
Okay.
She points out a major misconception. People think the cervix is just some loose cap sitting at the top of the vagina, like, I don't know, a lid on a jar. But it is literally the neck of the uterus.
It's the bottom portion of a much larger organ structure.
Precisely. And that structure is anchored securely by incredibly strong ligaments attached directly to the pelvis. Dr. Bashakal makes it very clear it is anatomically impossible to detach or, suck out a cervix with a commercial menstrual cup.
Oh, thank goodness.
Right. The only way a cervix completely detaches is through a surgical operation like a hysterectomy, or in incredibly rare cases, a traumatic vaginal birth. A small piece of folded silicone cannot rip an anchored organ out of your body.
Okay, let's unpack this, because even if it can't rip an organ out, Lux did end up in the hospital in immense pain. If the cup is just made of soft, flexible, medical-grade silicone, how is it causing real damage?
I keep thinking back to that heavy-duty suction cup on the glass window.
It's a great analogy.
Right, if you just grab the hook of the suction cup and yank it backward with all your strength without peeling up the edge to let air in first, you're going to stress the glass or at least, break a sweat.
And the underlying mechanism here is exactly the same. You cannot just yank. While you can't pull the cervix out, Dr. Bajekal notes that if a menstrual cup is pushed up too high, sitting flush against the cervix, and left there too long, pulling on it with unnatural force creates intense negative pressure.
Ouch.
Exactly. That localized vacuum can cause actual bruising and severe swelling of the cervical tissue. It actively pulls blood to the surface. Which perfectly explains one of the Reddit threads in our stack. I was reading this account from a woman who is actually a third-year midwifery student. So this isn't someone guessing about her anatomy. This is someone who studies the pelvic floor for a living.
A scenario where she already understands the landscape she's navigating.
Exactly. But she was on her third day of using a cup and was trying to reposition it, and she got pinched by the silicone.
Oh, no.
Yeah, she panicked because of the sudden pain, and her instinct just took over. She grabbed the stem and yanked the cup straight down as hard as she could. She didn't break the seal.
Ah, that is the worst thing you can do.
Because of that unbroken vacuum, the widest diameter of the cup stayed rigid and forcibly stretched her perineum as it dragged outward. The pain was so bad she had to go to urgent care, where she was diagnosed with a first-degree perineal tear.
Wow. And that tear was caused entirely by mechanical friction and unbroken suction. When the vacuum isn't released, the cup doesn't just slide right. It aggressively drags the delicate vaginal walls with it. This really highlights the absolute golden rule of menstrual cups, which is a non-negotiable for anyone using them. You have to break the seal first.
The famous pinch.
Yes, the pinch is mandatory. You have to insert a finger, reach all the way up to the base of the cup, and squeeze it, or physically press the rim inward away from the vaginal wall. That creates a gap.
So the air gets in.
Right. Air rushes in, the vacuum pressure equalizes, and only then will the cup slide out harmlessly. If you panic and pull the stem like it's, say, a tampon string, you are fighting physics, and your biological tissues are going to lose that fight every single time.
So we've established what happens when you apply brute mechanical force and an unbroken vacuum to healthy tissue. You get bruising, swelling, or even a first-degree tear. But here's where it gets really interesting: what happens when that exact same suction is applied to tissue that is actively trying to heal.
That is where the biological hazard truly begins. When we look at the clinical guidelines from hospitals and women's health clinics across the board, there is a strict, universal consensus, 0 internal products for 6 to 8 weeks following any major pelvic event.
So we're talking childbirth, hysterectomies, and even like non-surgical procedures like laser or radiofrequency vaginal tightening. Nothing goes inside for up to 2 months. I mean, I understand wanting to avoid infection, but why is the suction specifically so dangerous here?
Well, let's examine the non-surgical tightening first. Procedures like RF ablation essentially create tiny, intentional, controlled burns inside the vaginal canal. The goal is to cause micro-injuries that trick the body into sending a rush of healing collagen to the area.
Okay, that makes sense.
Because of this, the vaginal epithelium, that's the delicate surface lining, is actively regenerating. It is hyperfragile.
It's basically like a layer of brand new skin trying to grow over a scrape.
A perfect way to visualize it. Now imagine inserting a cup. The sheer mechanical friction of pushing it in is bad enough, but then it pops open and creates a strong vacuum against those walls. When you go to remove it, even if you try to break the seal, the suction can literally strip that freshly regenerating epithelium right off.
Oh, that sounds awful.
It is. You aren't just causing pain. You are actively peeling the scab off from the inside, risking severe scarring and significantly delaying the entire healing process.
And the stakes get even higher after childbirth or a surgical procedure. Let's look at the postpartum risks. A lot of new moms want to use cups for lochia, that heavy, prolonged bleeding that happens after you give birth.
Right, but using a cup for lochia is highly discouraged by every single medical source we reviewed. After giving birth, the cervix doesn't just snap shut. It remains partially open for a prolonged period to allow that lochia, which is the shedding of the uterine lining, to safely exit the body.
It's essentially a one-way exit door that hasn't fully closed yet.
Exactly. And if you insert a menstrual cup, you are placing an airtight collection device right at the threshold of that open door. A cup can trap naturally occurring vaginal bacteria. Because the cervix is still dilated, that bacteria now has an unobstructed pathway up into the uterus.
That sounds like a major infection risk.
It is. The vacuum can even create a microenvironment that encourages this upward movement, creating a massive risk for severe, life-threatening uterine infections.
Okay, so for postpartum healing, the core issue is the open cervix and the bacteria trap. But I was reading through the post-op diaries from hysterectomy patients in our sources, and there's a strict ban on cups there too. This confused me at first. If someone has a full hysterectomy, the cervix, the whole area the cup normally sits below, is completely removed. What is the cup even suctioning to, and why is it so dangerous?
Good question. When a surgeon removes the cervix during a hysterectomy, they have to close the literal hole at the top of the vaginal canal so your internal organs don't descend. They sew it shut with dissolving stitches. That newly created, stitched-up sealing is called the vaginal vault.
So you have fresh, delicate surgical stitches at the very top of the narrow canal. If you put a menstrual cup in there, and it pops open to create a vacuum seal.
You are applying direct, intense suction to fresh surgical sutures.
That sounds like a disaster waiting to happen. It's like trying to vacuum a rug that has a loose, frayed seam. The negative pressure from the vacuum doesn't just pull on the surface of the rug, it actively separates the threads holding the foundation together.
That analogy perfectly captures the mechanical strain. If a patient pulls down on that cup without flawlessly breaking the seal, and remember, they are reaching up near fresh stitches to try and pinch it, the vacuum mechanically pulls on those dissolving stitches. The tissue can tear, literally pulling the stitches apart. This leads to what the medical community calls a vault hematoma.
I saw that term in the literature. That's essentially a blood collection, right?
It's more severe than a simple bruise. Think of a vault hematoma as a massive internal blood blister forming right where the surgical stitches are trying to hold the tissue together. It's a pooling of blood at the very top of the vagina.
Yeah.
It can easily become infected, requiring intravenous antibiotics or even a secondary surgery to, drain the blood and repair the torn stitches.
It is such a profound irony, though. The very mechanism that makes the menstrual cup so beloved by millions, its airtight, completely leak-proof grip, is exactly what turns it into a biological hazard when the body's internal architecture is compromised.
It really is. And we've established that suction is a massive liability for a healing wound, like a fresh suture or regenerating skin. But what about when the body isn't actively wounded, but is instead managing long-term structural changes or housing a foreign object?
Which brings us to the collateral damage of suction. I'm thinking specifically about IUDs, intrauterine devices. This is a massive question for listeners. If you have an IUD sitting safely inside your uterus, can the suction of a menstrual cup actually pull it out?
Well, the medical community debated this for a long time, assuming it was mostly user error. But we now have solid data. We looked at a systematic review published in The Lancet that evaluated over 300 menstrual cup users. Out of those, they documented 13 specific, clinically verified cases of IUD expulsion linked directly to cup use.
Wait, 13 out of over 3,000. So mathematically, it's a very low percentage, around what, 0.39%?
Yeah, small.
But it does happen, and the stakes of an unwanted pregnancy are incredibly high. How exactly is the physics of the cup pulling a device out of a completely different organ?
It's actually a dual threat. The first threat is the vacuum pressure itself. While an IUD sits inside the uterus and the cervix acts as a barrier separating it from the cup, researchers note that if a cup sits very high against a low cervix, the vacuum can create a subtle downward draft.
Ah, I see.
Yeah, and particularly in the first few months after an IUD is inserted, when the device is still settling into the uterine lining and the cervix is slightly softer, that sustained negative pressure can be just enough to slowly dislodge it.
But there's a second, much more tactile threat, right? The strings. An IUD has two little plastic strings that hang down through the cervix into the vaginal canal. They are left there intentionally so a doctor can eventually grasp them to remove the device.
And those strings are the primary culprit here. They can easily get caught between the rim of the menstrual cup and the vaginal wall. Worse, when a user reaches up to execute the pinch at the base of the cup to break the seal, they are operating in a very confined, blind environment. They accidentally pinch the IUD strings right along with the silicone.
It's like accidentally pulling the ripcord on a parachute when you just meant to unbuckle your backpack. You're blindly reaching around in a tight space, relying purely on touch. You grab what you think is just the base of the cup, you pull to remove it, and suddenly, oops, you've evicted your birth control.
The tactile confusion is exactly the problem, because the silicone can feel similar to the biological tissue in the strings. When everything is, slick, mistakes happen. The clinical advice from the sources is really clear. If you use an IUD, you should wait a minimum of 2 to 3 months after insertion before even trying a cup, allowing the IUD to firmly embed.
That makes a lot of sense.
You should also ask your doctor to trim the strings as short as safely possible, and you must be hyper-vigilant about feeling for those strings to ensure they are out of the way before you pinch the cup.
Which requires a massive amount of anatomical awareness and comfort. Speaking of anatomy, we need to talk about the pelvic floor itself. Our sources frequently brought up conditions like pelvic organ prolapse and vaginismus. Let's tackle prolapse first. Does the suction of a cup cause organs to drop?
This requires a very clear definition of the danger. A menstrual cup cannot cause pelvic organ prolapse. Prolapse occurs when the muscles and ligaments of the pelvic floor, which hold up your pelvic organs like a taut hammock, begin to weaken. When that hammock sags, the bladder, uterus, or rectum can drop down into the vaginal canal.
Got it.
That initial weakening stems from prolonged bearing down, chronic constipation, heavy lifting, or the trauma of childbirth. A silicone cup does not cause the hammock to break.
Right, so the cup didn't cause the structural weakness in the first place.
But consider the anatomy for a moment. If you already have prolapse, if your internal hammock is already failing, and your organs are sitting lower than they should, the vacuum seal becomes a major issue. If you pull a suction cup by the stem without perfectly breaking the seal, you are turning that cup into a suction weight.
Oh, wow.
You're putting dangerous, direct downward pressure on tissues and ligaments that are already struggling to hold everything up. It actively exacerbates the sagging.
So for prolapse, the suction acts as an unwanted weight on weakened muscles. What about vaginismus? That's a condition characterized by the vaginal muscles involuntarily tightening or spasming, making insertion of anything incredibly painful.
For individuals managing vaginismus, the challenge is twofold. First, the sheer mechanical friction of inserting the folded, relatively bulky cup can trigger the muscle spasms. Second, the internal sensation of the cup forcibly popping open, followed by the immediate localized pressure of the vacuum seal gripping the vaginal walls, causes severe physical pain and deep psychological distress for someone whose muscles are already involuntarily contracting.
So what does this all mean for you, the listener? If menstrual cups rely entirely on this uncompromising suction seal, and that exact seal is a documented liability for IUDs, prolapse, vaginismus, fresh stitches, and actively regenerating tissues, are people managing these conditions just stuck going back to traditional tampons and pads?
Not necessarily. Across the medical literature and the clinic FAQs we reviewed, doctors frequently point to a specific alternative, the menstrual disc.
Right, the discs. How do they solve the physics problem?
Well, menstrual discs look entirely different. Instead of a bell shape, they look like a shallow, flexible bowl with a slightly rigid, springy rim. The crucial difference is that they do not use suction at all.
Oh, interesting.
Instead of sealing against the walls of the vaginal canal, you push a disc all the way back, tucking it securely behind the pubic bone. It lodges there mechanically, kind of like a diaphragm.
Because it sits naturally on the bone ledge, there is absolutely no vacuum seal required to keep it in place, which means there's no suction to pull on stitches, no vacuum to drag on a prolapsed pelvic floor, and no ripcord mechanism to accidentally yank out an IUD.
Exactly. By switching from a bell to a disc, you eliminate the mechanical force of the suction entirely. It relies on your skeletal anatomy, not negative pressure.
So let's bring all of this together. Menstrual cups are incredibly safe, highly effective, and deeply eco-friendly tools for healthy anatomies. The vast majority of the time, they are a fantastic option, provided you respect the physics of the vacuum seal, and always, always remember the pinch.
But context dictates the risk.
Exactly. If your body is actively healing from childbirth, if you are recovering from a surgery that left fresh sutures, if your vaginal tissue is regenerating, or if you are managing a delicate internal device or a weakened pelvic floor, that exact same suction transforms from a reliable product feature into a dangerous mechanical liability. You cannot fight biology with physics and expect the biology to win without collateral damage.
Which leaves us with a truly provocative thought to consider regarding the future of period care. We've spent this entire discussion looking at how a vacuum seal, a rudimentary mechanical solution, can strip tissue, threaten stitches, and interfere with complex medical devices. The suction is undeniably a double-edged sword.
It's effective, but it's a blunt instrument.
Right. So how long until the industry moves past the blunt instrument of suction entirely? Could the next evolution of menstrual technology abandon the vacuum seal in favor of smart materials?
Oh, wow, like what?
Imagine biocompatible, temperature-activated polymers that, upon contact with internal body heat, perfectly and dynamically mold themselves to your unique asymmetrical internal shape. They could capture fluid seamlessly, adapting to your movements, without ever needing to exert rigid physical pressure or create a mechanical vacuum seal against vulnerable tissue.
That is a wild thought. Biodesign that adapts intelligently to the body instead of forcing the body to adapt to the aggressive physics of a product. It definitely gives you something to think about the next time you find yourself wrestling with a stubborn suction cup on a glass window. Physics is powerful, but human biology requires finesse. Thanks for exploring the mechanics with us today. Until next time, keep questioning the hidden science of the world around you.